Hi, my name is Patricia and I am a sterile processing technician. As a sterile processing technician, our job is to make sure all instruments are sterilized properly for the safety of all our patients. First, let's talk about aseptic technique. Aseptic technique means using practices and procedures to prevent contamination from microbes and pathogens. Doing so following the strictest rules to prevent a risk of infection in accordance with the Association of Advancement for Medical Instrumentation. I will be wrapping a basic tray, in this case a suture tray, which is commonly used especially in the ER. It is to treat, the instruments in this tray will treat any cuts or abrasions. As you can see, I have set up all my instruments, my wrap, my tray, everything that I need to make this possible. My instruments have been properly decontaminated, which means they have been washed, rinsed, inspected, and dried. I will be using a non-woven wrap. A non-woven wrap is a very common wrap to use. The thread of this wrap is very tight, which means the chance of microbes and pathogens and soil and dust from getting in is very slim to none. But the problem with this type of wrap is that it is not too good in terms of retaining moisture, keeping moisture, outside the tray. For this reason, I will use a hot towel to achieve absorbency and to avoid wet packs. As you know, when you have moisture, wet packs form, and wet packs are considered dangerous in terms of sterility because moisture tends to promote the growth of microbes and bacteria. I will be using a simultaneous fold. This fold is very common as it is, you only require to wrap the tray and the instruments once. It also gives you the chance to only have aseptic presentation once, but it is it's a time-saving type of fold. It is called simultaneous fold. And the technique I will be using is the envelope technique. Now, the envelope technique is commonly used for small trays or basic trays and small instruments, as in this case. Now I am ready to proceed to fill the tray with my instruments. We have scissors. Remember to always have the hinges opened. We have the hemostats. We have forceps. Scalpel. Cheek retractor in case it is needed if a cut happens to be around the face. We have a container in which you will use to fill the aseptic solution or saline. Some gauze that you will need to clean the wound. A needle driver for the stitching. This is an irrigation syringe, which is, it looks like plastic, but it's a material that it is accepted and it is okay to put through the sterilizer. We have the sutures. As you can see, I am placing all the instruments on top of the hot towel for absorbency and to wick away moisture. And last but not least, of course, we have the suction tip. Now, the important part of wrapping an instruments is for us to know, depending on the cycle we use, if the instruments have been completely and 100% sterile. For this specific case, I have double checked my wrap for any cuts, any holes or anything that will compromise the sterility of the packages. And that is very important. You have to always check for your wraps to make sure they have no threading, no burns, nothing that will allow for microbes and pathogens to get in. So this has been checked. Okay, now what I have to do is to fold. The fold, like I said, is called the envelope fold. And you start by placing the tray in the middle of a diamond shape wrap. And you fold the bottom part first. You do a little tab. Now, in terms of the tabs that you use when you fold, the tabs are used to help with the aseptic opening of the packages. So when this package gets to the surgeon or the doctor, they will not have to touch any other part of the package but the tabs. And that is the reason why we use the tabs. I forgot, this is very important. This is my chemical indicator. A chemical indicator is an indicator that will tell us that all instruments have been sterilized 100%. The cycle I am using for this sterilization is the steam cycle. These instruments will be sterilized in the autoclave. So these chemical indicators especially designed for steam sterilization. I will put this inside and it will change colors. So when the nurses or the doctors open this tray, this package, they will see that all instruments inside have been properly sterilized. So here we go. First we do the bottom, do a tab, then we fold the right corner and we do another tab. Then the left corner, and we do another tab. Usually the type of wrapping is across the board the same, the different types, so all doctors and nurses will know the procedures of how to open them and using it the proper aseptic presentation without risking the sterility of the instruments. And last, we fold the top. We can do something like that to create another tab at the end. And now I'm going to use my indicator tape. An indicator tape also will let us know if the package has been sterilized completely. It will change colors. The lines that are white right now will become black, and that will let us know that the package is sterile. That doesn't mean that the contents of the tray are completely sterile. This is why I am using also a chemical indicator for the inside. Make sure your package is wrapped tight, but not too tight. Making sure that all sides are closed. There we go. When I take this out of the autoclave, it will show me black lines, which will mean the package is sterile. When I open it, or when the doctor or nurses open it, the chemical indicator inside should have changed colors, indicating that all items inside, all instruments are also sterile. Last but not least, after we finish this type of wrapping or any type of wrapping, we have to put a label. In the label, we must put the name of the contents, whether it be small tray, suture tray, whatever the name, whatever it is known. In this case, I have put suture tray. The cycle type, I put steam cycle autoclave. The date that you're sterilizing it. And also lot number or any other inventory number as you see fit. And the most important thing after all this is your initials, the initials or name of the person who is doing the wrapping. This is done so the person can have accountability. If in any event something has happened and the tray was not properly sterilized or they found holes in the wraps, the person that wraps the tray has to be accountable and responsible for this. And that is the reason. So here we go. You can put it here. That is the label. And now, last but not least, I am going to put the barcode. The barcode is indicates for quality assurance the name of the items, inventory control, rotation, stock rotation, etc., etc. Some hospitals have a bar control gun, which I do, and some don't. So in the event that your hospital or your workplace doesn't have a gun for it, a special gun, you will have to write this yourself and just have to tape it onto your package. So let me do the gun. That's it. Now this package is ready to go into the autoclave for a steam cycle. Last but not least, if you have any doubts, if you think something has altered or compromised the sterility of the package and the instruments, you must reprocess. Thank you.